Assalamu alaikum dear doctors. In this video I am discussing bleeding. Haemophilia history, how can we take? So for haemophilia history, first we ask about the OCD, onset, when it started, the course and the duration of the bleeding. Then site of the bleeding, exactly which site the bleeding occurred. Is that first time occur or not? Hook-up. Hook-up, we know that H for hemodynamically stable or not, O for onset, C for color of blood, A for amount of blood, and B for any blood transfusion history. Then the bleeding started by preceded by any trauma, any surgery, illness, fever or drug. And how bleeding stop? Easy bruises. And is that any other concern associated with this bleeding? The child has any dysmorphism feature, chronic any disease present or not, FWASL and activity. We know FWASL, that is fever, that is weight loss or weight gain, W for A for activity or appearance, S for sleep, and L for lymph nodes or glands. Then we ask the systematically. First, MSK, that is musculoskeletal system, any spot, any lumps present or not, swelling, hair, nail, pain over the bone, joint or muscles, this bleeding, any fracture associated with this bleeding, any bone carving or contracture present or not, lax or stiff joint. Next, we check the CNS. Is there any increased intracranial pressure present with this bleeding, like headache, nausea, vomiting, weakness, facial asymmetry, eye deviation, abnormal movement and walk, concern about vision, hearing, speech. Is that the vision and hearing, speech is normal develop or not? Next, we check the chest. Chest cough present or not? Is that cough blood mixed or not? Musical sound or recurrent bug infection, any chest pain. Next, we check the CBS. CBS ask about hook-up. We know hook-up, H for hemodynamically stable or not, O for onset, C for color of blood, A for amount of blood, and B for blood transfusion. Now next is urinary system. We can ask about the P color, amount of P, any bug or blood pressure, and endocrine. Past history. In past history, we know the mnemonic 5T IOA. 5T, that is any trauma history, any what are the treatment past he has taken, and any traveling history in past, blood transfusion history, and which blood multidisciplinary team is involved for treatment in past. IOA, that is any investigation past, onset and admission occur. Then all special drug, radiation, transfusion, swelling on IM injections. If male, we ask about circumcision in hemophilia or bleeding case. Next, about puberty. If yes, and ask about puberty started or not, we check. Then ask about the frequent amount of bleeding of the menstruations, the duration of menstruation, paired changes menstruation in 2 hours. Menstruation is that it is more than 7 days the duration, and more than one time in menstruation per month. We'll check all this. Perinatal history, all special if small age, vitamin K, is that the child taken vitamin K injection or not, we can check. VAND, we know VAND, that vaccination history, did the child take all the shot, A for allergic history, any drug or food allergy present or not, and for D for development, and for nutritional history. Then growth chart, social history, family history will take, who is the earning member, is that in family issue, stressful issue, psychological, we check any bullying in the school or not, like that. Then if already diagnosed case it was, that the patient has already diagnosed previously, then we can ask when it was diagnosed, why, by whom diagnosed, like which doctors they diagnosed, blood doctor or any other department. Then lab test, what are the lab tests they done, treatment about they give tranexamic acid or desmopacine factor 8 level of the factor need to increase factor transfused if he is taking it, the side effects of any treatment occurred, the severity, how was the severity that time, history of serious bleeding before, any operation past history, any admission follow up, any ICU, any special any events past occur or not, we will check. So now what are the differential diagnosis of bleeding tendency? The bleeding tendency differential diagnosis, we know general cause are hypertension, liver failure, vitamin K deficiency, also vitamin C and vitamin D. Next, platelet disorders, that is decrease the number of function defect. Coagulation defect, example hemophilia present with bleeding disorder. Vascular disorder, von Willebrand disease, VWD. Then pancytopenia syndrome, Noonan syndrome, Chediak Higashi and Fanconi. These are the differential diagnosis of bleeding. This is all about. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.